I'm going to talk about a particular patient because it's very touching for me when patients do really well. And one thing about artificial disc replacement in the lumbar spine or the low back that's different than lumbar fusion. You know, when I have to do a fusion, which is rare, the patients are better and they're like, yeah, I feel a lot better, thanks. I know I've had a fusion myself. But when you do an artificial disc on a patient, they say, wow, I'm fantastic. There's a difference between the two. And this is an example of a 49-year-old man who came to see me in June. He had 8 years of back pain. And he had been doing physical therapy, exercise diligently, reserve police officer. His name is Martin. Great guy. Tried everything. Said, I've had it. I need surgery. What's wrong with me? He had an L5-S1 disc that was degenerative. He was told he had to have a fusion. I did an artificial disc on him. We're going to put what he said in a caption so you can read it. But letters like this mean so much to me. I really like it more than anything. I put them in a little scrapbook out there for people to read. It helps the patients feel more comfortable before coming in to see me when they're scared. You can check that out, and we'll see you next time.